Okay, so what we're going to talk about today is the cat-friendly clinic. We're going to start with the basics of cat behavior. We're going to talk a little bit about the nutrition and management of pet cats, because this is what you need to pass on to the pet parents or the owners when they come to you. So you need to know how cats are managed at home, and this is very critical information in treating well and diseased cats. We're going to talk a little bit about critical care nutrition as well, and why it's so important in cats especially. We are going to talk about stress in cats, how to identify it, how to deal with it, how to recognize it, and systemic manifestations of stress. And this is why it's important to us. Stress in cats can cause disease. Okay, we're going to move on to the cat-friendly clinic and some of the recommendations for a cat-friendly clinic. And finally, we're going to talk a little bit about handling and restraint of the feline patient. To start with, the behavior of the cat in the clinic is dictated by three factors. One is the patient or the cat itself. The second is your practice environment of the clinic. And the third is the practitioner or you. By the practitioner, I mean whoever is handling this cat. Okay. They say that the first experience of the cat in the clinic can have a lasting impact on its well-being. Okay. When I graduated 20 years ago, a phrase was being bandied around that said, a cat is not a small dog. Okay. And this cat looks like a small dog, but they really are not. And understanding these critical differences helps us to put in place what we call feline friendly practices. Okay. So moving on to the first part of our subject of this course, actually, which is the patient or Felis catus, Felis sylvestris catus. They are very
unable to see you, ma'am.
You are unable to see me. Let me see why you're unable to see me.
I request everyone to post your query in chat box instead of speaking in between the webinar, please. I request you, please.
Are you all able to see me now?
Yes, ma'am.
Okay, wonderful.
Because that depends on your network and other things. If you are unable to see, please log out and log in again.
I will rely on you, Dr. Sharma, to let me know if there are any technical glitches. Okay.
Yes.
Okay. Thank you. Okay. So moving on, they are solitary creatures. This is a very important thing to remember, that cats are solitary creatures. They hunt solitarily, they live solitarily, and they do have communities, but they feed solitarily. Okay. They have complex and changing social interactions, and they have a wide array of communications that they use, both intra and interspecific. What that means is to communicate amongst each other as well as with other humans, animals, etc. For example, the cat will come and rub its head against you and rub itself against you, or rub itself against furniture. Sometimes they will groom each other. These are called allo rubbing and allo grooming. And these are cats communicating to each other, and this affiliative colony odor, which is common among colony cats, they are saying, these are mine, I own these. Okay. And what is not mine? Cats are very, very territorial, and they spend a lot of time marking and remarking their territory to reassure themselves. Okay. The last thing and very important thing to remember is a cat is a prey and a predator species. And we know from the first point that they are solitary. So their first response, they are small creatures, they will always choose flight over fight. So given a choice in an unpredictable situation, a cat will always choose to run away over trying to fight. Okay, and this is important for us when we are handling and restraining cats. So those were the claw marks that you saw that the cat was scratching on the wall. And this is a cat using a cat scratcher. Giving the cats an opportunity to scratch is very, very important. They have scent glands in their foot pads. And when they're scratching, they're not only leaving communication signals, they're leaving marks for other cats to see that this is my territory, but they're also leaving, again, their own affiliative colony odor to mark territory. So if you want to save your lovely furniture like this sofa at the back, then it's very, very important for pet parents to understand that they need to provide opportunities for the cat to scratch. Okay, this can be vertical or horizontal. So how do cats communicate? We talked about the wide array of communication skills that they have. Okay, They use distance communication. We talked about how sense sensitive they are. So apparently cats, the nasal surface olfactory epithelium is 10 times that of humans. They're very, very sensitive to smell. Okay, they pick up a lot of sense. They pick up a lot of different information from sense. And they have this colony odor that they are trying to pass on to in their territory, marking everything that's in their territory. That reassures them. Again, these scent pheromones, which are all in the head, neck area, are what we synthetically use to calm cats. So they have a very important function. They have a function in territory marking. They have a function in sexual attraction of mates. They have a function in calming cats and telling them this is your home territory, this is safe. Important to know. So a couple of other things that they use for distance communication is urine marking. So you see, I've put a photograph of this cat and the tail is erect and it is spraying urine against a vertical surface, a small amount of normal urine sprayed against a vertical surface. And this is urine marking. Now, we usually commonly associate urine marking with male cats, intact male cats marking their territory. This is not necessarily true. Both neutered and intact female and male cats can mark territory. They can do urine spraying or urine marking, but it is most commonly intact male cats. Okay, they will do it for reasons of territory marking. They will do it for reasons of sexual attraction, and they will do it as well in anxiety or stress periods. They use scratch marks, as we have talked about, and midden is uncovered feces. So it's deposition of a little bit of feces around the perimeter of their territory to let other cats know that this is my territory, don't come in. Okay. So this is the distance communication that they use. And then when they're in proximity, so a cat is close to you, face to face with you or with another cat, and they will use different communication in this case also. They will try all possible visual and vocal cues to tell you to go away before they react. And as practitioners, as handlers, we need to recognize these cues and change our handling tactics to avoid getting, bitten or cut. I don't know if you guys can see the marks on my hand. Anyway, so the tactile cues that they use are rubbing. So rubbing against each other, it's called bunting when they, bump their heads against people and objects. Grooming each other, kneading we talked about. So they will do this, it's called kneading biscuits, and you will see cats when they're trying to, communicate or they're relaxed and they're comfortable, they'll do a kneading signal. There are sense signals, there are visual cues. So other than the touching and the scent, which is also distance and proximity, they have visual cues, and the visual cues are posture and facial expression. Okay. Vocalization is also a distance cue as well as a communication cue. Obviously, it has to be face to face for someone to hear their vocalization. In terms of visual cues, we look at posture, which means the head, the body position, as well as the tail position. Okay, and I'll give you a classic example. We've all seen on postcards or in cartoons, you see the Halloween cat, which is like a cat with an arched back with the tail raised, and the tail hairs are erect like a bottle brush looking at you. So this is a very scared cat putting on a facade of increased size and confidence to try and scare away a predator. Okay, this kitten on the right is doing a crouched pose. This kitten is scared, it is wary, it is crouching on all four legs and ready to run away. It's ready to take flight. Okay, and of course there is the stalker pose, which is a very confident cat in terms of its posture, but its facial expression, ears are backward, and it's growling and it's telling you, look, I'm not scared of you, I will attack. Okay, again, facial expression is important. You have to look at the ear position and what the eyes look like. If your ears are nice and forward and relaxed, and I will show you this in a photograph of a cat eating a treat from one of us. If they are flat or aeroplane ears, so they're flat and on the side. Okay, I'll show you one second. I'll have to show this to you.
Okay, not okay.
So this is a slightly more relaxed cat with the ears forward. It's resting in a box, so it's wary, but the ears are forward. It's curious. And finally, you have a cat whose ears are flat and outward. This is your aeroplane ears, and the eyes are slightly narrowed. This is telling you that this cat is scared. Okay, as much as I want to hug this cat may not want to be hugged or cuddled. Okay, again, if your ears are turned backward, if the cat's ears are turned backward and erect and it's growling, this is obviously a warning sign to stay away from this cat and not to try and handle it. So it's important for us to recognize the fear response, because only at the end of the fear response do we get an aggression or an aggressive bite or a scratch. They will freeze. They will try and take flight. If they can't and they're stuck somewhere, only then will they try to fight, or they will go into a corner and they will fidget. Okay. I just want to mention at this point, as we mentioned, this is a basic medicine course. So I want to introduce a concept that at every examination, it is important to also try and recognize pain. And one of the easiest ways to do this is the University of Minnesota has validated this feline grimace scale. Fear, stress, fear or stress, pain, and illness in cats can look very similar. And that's one of the challenges, is to try and figure out which one of it the cat is trying to show you. So in the grimace scale is very easy. They have cats with 3 different expressions, and you get what is called an action unit, or AU. Okay, and each action unit has either 1 score or 2 scores, and there are tables. So they look at ear position, they will look at eyes, they will look at what the muzzle looks like, whisker position, and they look at the head position. And you can see that there's a very marked difference between the left-hand side cat and the right-hand side cat. If a total score is more than 4, that means the cat is showing pain. Obviously, there has to be some sort of history of a painful event, or there has to be other palpation, etc., that also corroborates with this. But that's when you know you need to control pain better. If your cat is already on painkillers and has a score of more than 4, that means you need to update your analgesia plan. So I'm going to show you a little video of a cat. He's finished treatment. He's an outdoor cat. He is not used to a lot of human interaction. And just a little video with some open mouth breathing. Okay, anyway, let me describe it. It's just a short video clip of a cat sitting in the cage, vocalizing a little bit, but also showing open mouth breathing. Okay, and there's 3 main reasons that a cat will show open mouth breathing. One, of course, is dyspnea or respiratory distress, where it's accompanied by other signs and it doesn't go away. The other one is either a cat has come in the car, or it's come in the heat, and or it's just been handled and it'll sit down and show open mouth breathing, and this can often be a sign of stress. So cats receive an overwhelming olfactory message at the clinic when they come in. There's lots of unfamiliar people. There's unfamiliar sounds. There can be clipper sounds which scare them close to them. So it's important to invest in a small noiseless clipper if possible. Beard trimmers work very, very well, actually. Predatory noises, dogs, other cats. This is all very unfamiliar and scary for a scared cat, for an anxious cat. Also, it's important to understand, as safe as carriers are, the lockable carriers are, there is no escape route from carriers, and putting a cat anywhere where there is no escape route is in itself a source of stress. Again, in this context, I would like to mention that it's very important to tell owners not only to invest in a carrier, but to invest in time to train the cat to use the carrier, to keep the carrier open at home, to put treats in the carrier, keep a mat or a towel at the bottom, and encourage the cat to actually use the carrier, so that when they're bringing them in the carrier to the clinic, they don't associate it only with a scary place or a bad experience. They don't like cold surfaces, so something as simple as putting a mat or a towel on the cold surface helps. You have to respect their sense of smell, which means that as good as a very strong Dettol is to clean the tabletop, if you have cats coming in, it's important not to use a very strong smelling disinfectant. And of course, cats feel a direct sense of threat when they are stared at in the face. So it is important to approach them from the side or from behind, so as not to make them feel threatened. So the last person in terms of the cat's behavior in the clinic is you, okay, you or the handler. And it's important to understand that, again, white coats, our lab coats, can be intimidating for cats. We can wear normal clothes, so the cat doesn't associate bad things with a white coat. A cat is scared in the clinic, he will first try and communicate with you, then he will try and run away, and only then will he try to defend himself. And a cat really has 5 mouths, because it has 4 legs with claws that work very well, and a mouth in addition. Okay, again, we are a rabies endemic country. It's important for you and the safety of your staff every time a cat comes in to check that it is rabies vaccinated. Okay, this is very imperative for team safety, handler safety, and your safety. Okay, they say that when the cat is cuffed, it resembles the attempt of another cat to dominate in a fight, and it doesn't belong in a cooperative, conciliatory, and I don't know, respectful setting. Whenever you're handling any animal, there are 5 principles of restraint. Okay, and there are 4. And in order of priority, it starts from the first priority is safety of the handler. The second priority is safety of the animal or the patient. So you don't want to hurt the animal inadvertently. The third is you want to maximize the safety of the procedure. And fourth, you want to maximize humaneness of the procedure. But in all this, it is up to us or whoever is facilitating the handling event to decide what is more important. If your cat is going to run away or turn around and scratch and bite, and then you have a free cat running around in the clinic, you can't catch it because it is aggressive, decide. You can do scruffing. So what we do sometimes, and you can see this cat is being made to sit up, it's getting subcutaneous fluids. There's a gentle scruff on the neck, and to know that, look, you're being restrained, don't try and run away. But in no way are we being harming it or sort of compromising it in any way. Okay, so there's a little bit of a balance over there between a respectful cooperative setting versus principles of restraint. Handler safety should always come first. So moving on, now you have your cats coming into your clinic, and the first question you're going to ask them is, look, what are you feeding your cats and how are you keeping them? Okay, when you do your history taking. And it's important that we understand as well what our cats need, because we are the ones who are then going to advise pet parents or clients. Cats are obligate carnivores, as we discussed, and this is because of many physiological adaptations that they have. So they have a small stomach, their dentition is so designed, they have short gastric transit times, they have lack of salivary amylase. So they are not built to process a lot of carbohydrates. Okay, they are built to process proteins. Again, like I mentioned before, they are solitary feeders, and their hunting drive is independent from hunger. When does this become important? This becomes very, very important to understand that when there are ample resources, because of its hunting drive, the cat will go on eating. So to explain to people that, look, if you give a cat a chance to see that there is the cat's resources over there, even if it is not hungry, it will go and eat. And this is very, very common in a multi-cat household, or where people are free feeding cats. They leave the dry food out and the cat keeps eating. Okay. And anatomically and physiologically, the cat is actually designed to eat 10 to 20 meals in a 24-hour period. We can't always replicate this in captivity or with our domestic pet cats, because unless you have an automatic feeder, this becomes a little difficult to do. But 3 to 4 meals is a good idea. And to prolong some meals with enrichment, which we will talk about, is again something that we can do to make their lives a little more enriched. Again, stress can cause them to reject new tastes and textures. So if you have a sick cat and you've diagnosed a chronic kidney disease, this is not the time. When it's not eating is not the time to change diet, unless it's really, really imperative or acute. It is important to wait for them to eat well and slowly transition all diets, because if a cat stops eating, that can cause a whole new plethora of problems. Again, every single cat consult, every single time your patient comes into the clinic, a nutritional assessment, and we will be talking about this in the next lecture. It should involve body weight, body condition score, and a muscle condition score. And we will be talking a little in detail about this. So some math that I hope we will understand. Just going to give you a little bit of this is not something that I do daily in the clinic either, but it's important to understand when we talk. So the 2021 guidelines, AAHA, which is the Hospital Association Nutrition and Weight Management Guidelines, the formula for RER, which is resting energy requirement, is body weight into kg raised to 0.75 into 70. This is a resting energy requirement for any animal. So the maintenance energy requirement, which is actually the daily amount of energy a cat needs to consume, is equal to RER into life stage factor. Okay. Down here, you will see there is life stage factors. For a neutered adult, it is 1.2 to 1.4. For an intact adult, it is 1.4 to 1.6. So it's slightly less for neutered adults. Inactive or obese prone animals, if we see that the animal is prone to putting on weight, on 2 subsequent visits, you have noted that there's a gradual increase in weight, your life stage factor will go to 1, which is, that means you feed it along according to RER. Fortunately, there's a slightly easier formula for this, which is 30 into body weight in kgs plus 70. Okay, and this is quite easy to calculate. Why does this become important? It becomes important more when you have either you're trying to do a weight loss diet or you're trying to feed a critically ill cat. Okay. Very often clients will come and they will ask you, or they will ask you on the phone, look, should we feed wet food, which is the food in pouches, or should we feed dry food, which is the kibble, the small kibble that comes in the dry food that comes in the packets? Cats are very fastidious. They don't like change. And they are choosy not only about taste, but also about smell and texture. This makes changes very difficult. So it is important from when they are young to try and get them used to as many tastes and textures and smells as possible when they are kittens, to expose them. Because of course we are limited by local availability, and all of this impacts our decisions. Expenses impact our decision. If you look at premium cat food segments, for example, the wet food is a lot more expensive than the dry food. Okay. There is a way to work around this, and I can share with you my experience of what we advise and why we advise it. There are also very good nutrition guidelines that are available that you can follow. So wet diets tend to be higher in moisture. They are more than 75% moisture, and they are lower calories and carbohydrates than dry diets. Okay, the dry diets are called extruded diets because that is the process of extrusion to make the kibble. And this process requires more carbohydrates. So definitely dry food has more carbohydrates, and it is less calorie dense for cats than wet diets. Also, it has less than 10% moisture as opposed to more than 75% in wet food. Cats, because of their evolutionary, they are evolved hunting small prey. So they require high protein, moderate fat, low carbohydrates, and some amount of fiber. And this is important to remember. So what we advise, when we work backwards, later on, we'll be talking about blocked cats and urinary issues, and a lot of disease conditions come back to a recommendation saying, look, a long-term management should increase 60% moisture in the food. Many of my cat pet parents will come in and say, look, my cat just doesn't drink water. It's sometimes they have preferences for how they like their water also, in terms of running versus still, from a saucer, from a tape, from licking it off something. So if we can incorporate that moisture in the food, we want to work backwards from 60% moisture in the food daily. So if we can make the wet diet 60%, okay, and we know the dry food, and they will drink some water, somewhere we are safeguarding ourselves to allow for this. So then when we are saying dry food versus wet food, what we advise is you want to feed some wet food. So maybe you have to follow. So each of these package, all of the commercial packets have recommendations. They have feeding charts at the back. Okay. And they say that if you are feeding a combination of dry and wet food, which is what we advise, we say that if you look at even a 5 kilo cat, for example, okay, it says 45 grams of dry food with 1 packet of wet food. Now, this is an example of, I don't know, Royal Canine instinctive adult. It's an adult food for normal activity cats. You also get it for indoor cats. You get it for neutered cats. You get weight management diets. So most of our cats are not 5 kilos. They are between 3 and 4.5 kilos. 3 and 4.5. Okay. If you look at a 3 kilo cat, it requires only 26 grams of dry food. This is very, very little dry food. Encourage people to read the back of the chart. So what we say is, look, give them wet food, give them that pouch or whatever you're using as wet food, twice a day, thrice a day if necessary. And in a daily ration, you must not exceed more than 35 to 50 grams of dry food per cat per day, unless advised by your veterinarian. Again, we know that dry food has a lot of carbohydrates required for the extrusion, for the kibble process. And so it is better to opt, even if you are sort of not buying a very, if you don't want to spend a lot of money to buy a good quality dry food, because the packet will last you longer if you limit it to only 35 to 50 grams of dry food a day. I mentioned about kittens and exposing them to different flavors and textures. This is very important. Some special feeding has to be, undertaken for long-coated breeds, because the Persians and other long-coated breeds, cats will shed and they groom themselves. They're continuously grooming. As a result, they ingest a lot of hair. A lot of them will regurgitate their hair as hairballs once a month, twice a month, but some of them don't do that. Okay, so it is then important to either feed the long haired cats or cats that are over grooming or shedding too much some diet which has hairball control. The Persian diets will have it. Some of the diets actually mention hairball control, and it's important to look for these. Suppose these are not available, or the client or the owner does not want to buy these, another option is you get something called hairball paste. It is an insoluble malt paste which is not actually absorbed by the system, but what it does is it basically binds all the hairs and acts as a laxative and helps it to pass through the system without causing a trichobezoar or a hairball obstruction. Okay, sterilized cats, they know today that sterilized cats have a lower requirement. There's a scientific reason for this, for calories. That's why they tend to put on weight. So they say that after the cat is sterilized, it's calorie deduction. There is a calorie deduction of 25%. So they should be fed to 75% of MER. Okay. Or there are foods available which are already doing this for you. They are called indoor or sterilized foods made by different companies. And once the cats have been neutered, these can be opted for. Senior cats, again, there are some food options. This depends on where availability and what the pet parent wants to do, but there are options for senior cats as well. When we talk about food, one of the biggest problems we have is obesity. Okay, and It's a very common nutritional disorder affecting more than 50% of indoor cats. The reason is a combination of things. Number one, owners feeding kibble, free feeding it, leaving it there. When it gets over, they replenish it. This is a very unhealthy way to feed a cat, because like we know, when there are resources, they will eat even if they are not hungry. Multi-cat households, due to anxiety and stress, we see a lot of obesity because they are sharing resources. They don't know whether they will have access to the resources later. Okay. Less exercise sometimes. Outdoor cats have a lot more exercise. Again, we will be talking a little about this. So weight management in cats can be very challenging because in any case, transition of diets needs to be very gradual, and they tend to be fussy, and there are not a lot of weight management options around. Even if you use a weight management diet, it's important to also do things like using puzzle feeders and increasing exercise for the cat while doing the weight management diet, because you can do the weight loss, but the long-term management is to correct the underlying issues. So activity and behavior should be modified long-term. Again, you have to feed 65 to 80% of the resting energy requirements, and you do get commercial diets. This is just one example. And they will tell you what is the amount to be fed for weight loss. And once you have the target weight loss, what is fed for weight control. All these cats need to be monitored, because a drastic weight loss or a cat who stops eating can become ill and diseased. This is important to look out for. It's important not to tell owners who are on these diets or changing diets not to let a cat go hungry for more than 24 hours. Okay. They've also found that you can do a 12 weeks. So this is the ideal time that you want to spend 3 to 6 months doing a weight loss and weight management, is possible with 52 plus or minus about 5 kilocalories per kg, feeding this amount every 24 hours. So this is a little bit about obesity, which is quite a problem. And then going to the other end of the spectrum, which is critical care nutrition. Now your cat is not eating. When do you think about nutritional support or assist feeding? If your cat is ill and has had inadequate food intake, not no food intake, but even inadequate food intake for more than 3 days, you must consider assist feeding. There are some indicators of overt malnutrition. So this is, where you want to say that, okay, now I must pay attention and do something quick, and your choices will depend on this. If there's more than a 10% loss in body weight over a few days or a week, if there is a muscle loss, if there is hypoalbuminemia or decreased BUN because of protein losing or some factors like that, vomiting, which needs to be controlled or has not been controlled, all of these factors need assist feeding practices to be put in place immediately. Before you do anything where you try to force feed a cat or assist feed a cat, it's important to stabilize the cat first with fluid, acid base, and electrolyte abnormalities. Again, the amount you feed and the kind of food that you feed a cat when you're assist feeding it, depends on any other comorbidities. So it's important to assess for any cardiovascular. If there's uremia, for example, you will reduce the protein content of the food. If there is hepatic failure, you will feed a different kind of food. So these are important to assess before you start feeding a cat. Why do we jump in to feed cats? Because unlike in other species, they suffer from something called idiopathic hepatic lipidosis. Okay, what happens is that they utilize protein to a large extent. And when in the face of starvation, they are not able to downregulate the proteolysis, the mechanism of proteolysis. So what happens is that there is less formation of lipoproteins because the body is not ingesting and absorbing proteins, but there is increased mobilization of lipids from the liver. And so you get hyperlipidemia and you get jaundice, hyperbilirubinemia, and this is called hepatic lipidosis. Okay. When the cats don't eat, there's also been proven that there's a detectable decrease in immune function in inappetent cats by day 4. So it's important to step in early and to support them. What are our choices? Our choices are basically, do we need to go in and put in a feeding tube, or can we use appetite stimulants? And what decides this? Again, on how acute your case is. Is your cat not eating at all, or is it eating? Hyporexia is a reduction in appetite. Anorexia is a loss of appetite. If you have a complete loss of appetite, you probably need to step in sooner. If you have an inadequate appetite, you can wait a little bit or try other things, and we will be discussing when you use both. Okay, when you start feeding a very chronically malnourished cat or a chronically ill cat, a cat has run away and the owner has found them after 10 days and brought him back, and they start feeding, there is something that can occur, and this can occur even when you start putting in a feeding tube and feeding a cat, is something called refeeding syndrome. And this happens because there's a resurgence of insulin because of excess carbohydrates being fed. They leads to electrolyte abnormalities, some metabolic derangements. So there's hypophosphatemia, there's muscle weakness. And if it is not recognized and your feeding is not slowed down, it can lead to neurological and cardiac impairment. So when you are critical care feeding, it's important to follow guidelines, calculate. This is why your resting energy requirement is important. Do not overfeed and introduce the feeding again slowly, one step at a time. So when you manage your hyporexia, you feed to RER, not more than that. Earlier, they used to say feed +2, +3, and then they found, look, you can get refeeding syndrome. So feed only to RER, irrespective of how active the cat used to be. You want 25 to 35% of protein in your daily intake. So you have to choose a food which will give you at least 6 grams per 100 kilocalories. The only time you will restrict the protein is that there is encephalopathy or uremia. Then it becomes 4 grams per 100 kilocalories. So one very easy rule is, suppose you've put in a tube. We will be discussing feeding tubes in our basic techniques lecture, which will be the next module. But it's basically 1 can, if you take of a Hill's AD can, which is their critical care and recovery food, and you add 50 ml of water, you get 1 kilocalorie per ml. So this is easy to calculate how many ml you will need in a day. You calculate how many ml the cat needs in a day, and you actually feed only 50% of that in the first day. On the second day, you go to 100% of that. And then from the third day onwards, you divide it into sort of 4 to 6 feedings and feed to RER until the cat starts eating again or stabilizes. There's also a recovery of Royal Canine, where 1 can is directly 1 kilocalorie per ml. You don't need to dilute it with. I mentioned feeding tubes. So our options of feeding tubes include a nasopharyngeal tube, which is basically a tube that is fed into the pharynx from the nose. And I will be showing this to you next time. This is a short-term tube which can stay for less than 5 days. For a longer term, suppose you have a CKD patient or a cancer patient or some jaw surgery and you want a tube for a longer time, you use an O tube or an esophagostomy tube, which is a little more long-term. These are what we commonly use in the clinic. There is also a possibility to use gastrotomy and jejunostomy tubes, especially in vomiting patients, but these are more complicated and can lead to more severe complications. Okay. Moving on to appetite stimulants. So appetite stimulants is they're fairly safe appetite stimulants. Okay, but the caution while using appetite stimulants in cats is that you must never use them without first addressing pain and nausea. And in this context, Oriheal Lifesciences, you've seen they have a wide range of products, but they have a wonderful tramadol. Tramadol, if you've ever, is a very safe analgesic for cats, but if you ever try to feed a cat a tramadol tablet, it will foam so much because the tablet is bitter. And this is a very nice syrup because it's chicken flavored, and I've actually used it, and it's very helpful, very useful thing. You also want to address nausea because you will otherwise have failure. If you use just an appetite stimulant and you're not, hyporexia is a symptom, it is not a disease. If you don't correct the underlying disease, you can use something short-term to help. For example, in a CKD, you've stabilized the cat, appetite is poor. Yes, it helps to use appetite stimulants. It is not indicated in critically ill cats. So when you have a critically ill cat with anorexia, you want to opt for a feeding tube, not appetite stimulants. So the 3 commonly used ones is cyproheptadine or Practin in India, diazepam or Valium. It's very, very important. It can cause acute fulminant hepatic necrosis if given orally. So be very, very cautious about using diazepam in cats, especially orally. Mirtazapine is the most popular one, and it is available in tablets, which can be compounded. So the dose is 1.8 milligrams per cat every 48 hours. If it is not working and you're sure you have controlled for other factors, sometimes you can double the dose or you can double the frequency. So you go to 124 hours or you double the dose, but you should not go higher than that. Sometimes it can cause anorexia or make it worse in cats, but it has a slightly anti-emetic effect, which helps in CKD cases. Okay. And it's very, very useful also to be used very short term to transition diets in fussy patients. So that's another tip. So that was a little bit about nutrition. I think I'm going to head on. If we need a break of any sort, someone needs to let me know. Otherwise, I'm just going to keep going on. So there's something.
Continue.
Yes. Okay. Thank you. So there's something called whisker fatigue in cats. The whiskers are very loaded sensory organs. So the follicles, the base of the follicles of the whiskers have a lot of sensory receptors for proprioception, for, environmental input, air currents in dim light. They're dusk and dawn. The cats are most active at dusk and dawn. So these are one of the physiological adaptations that they have for that. But again, if you have a narrow bowl, like the one on the right top, you have a small dish with high walls, the whiskers are going to keep hitting this. And there's actually something that's documented that's called whisker fatigue. You can look it up. And what happens is that the cats actually start avoiding their food dish because this hurts them. It's painful for them. So what we recommend is wide dishes, preferably stainless steel, because they don't hold on to odors and they're easy to clean. Don't use a very strong dishwasher with a fragrance because the cats may not like this. And the other thing is they also have preferences for water. So they might want, you have to keep the food and the water in separate areas, and the feeding area should again be far away from the litter area. This is important for cats, okay? Sometimes they prefer moving water. So at the bottom, I put a photograph of what is a water fountain. You get ceramic ones, but there are plastic ones which are available on Amazon, at least to see that the cat likes it. So sometimes these cats will go to a dripping tap and start drinking. And they're telling you they have a preference. And it's important for cats to drink water. So if the owner says that the cat is not drinking water, it could help to try one of these. We mentioned about the feeding area being away from the litter tray. There are a couple of rules for the litter tray as well. So in a multi-cat household especially, or even in a single cat household, the number of litter trays should be cat plus one, always. It's always cat plus one. If there are 4 cats, 5 litter trays. The placement is important. You want to put it far away in a corner, which is not near something noisy, not near a door with a lot of movement. The cat should feel secure using its litter tray. The size of the litter tray is perhaps the most important thing. The length of the litter tray, which is usually a plastic tub, should be 1.5 times the length of the cat. And you can see from this photo on the right-hand side, this one is not. And most commercial litter trays actually don't meet this requirement. So it's important to look for one. It should be 1.5 times the length of the cat, and the width should be equal to the length of the cat. So 1 cat, 1.5 cat is what your ideal litter tray should be. Height can be anything from 5 to 7 inches. Sometimes cats who spray or they, cover up their soiling litter or urine with litter will need a higher wall. And again, this is a very nice, I took this photograph actually from one of the papers. It's a very nice idea where they've cut out one side of a plastic box. And so these low walls, for an old cat with mobility issues, it's really easy for them to go in and come out. In general, covered litter trays are not a good idea. Pet parents love them because, they don't smell. The litter is covered. Whenever they want, they will take it, open it and empty it out and scoop it out and refill it. But it's not good for the cat. Number one, because we know that cats like to have an avenue for escape. And in a covered litter tray, it's like a carrier. They don't have this. It's not very hygienic because out of sight, out of mind, people don't see how dirty the litter is and they don't clean or they don't scoop every day like they should be doing. And it also, in our high humidity, it withholds moisture and smell, and the cat often does not like this. So a general veterinary recommendation from science is, look, uncovered litter tray is better unless there is a specific indication to use a covered litter tray. Okay. So this is about litter trays. Other lifestyle choices. Some of our cats are indoors, some of them are outdoors. In Mumbai, we have a lot of cats in apartments. And I've mentioned bird netting at the bottom. It's very, very important to have some sort of grill or netting on the windows. This must be mentioned to clients because we have something called a high-rise syndrome where cats fall out of apartments. They're chasing a pigeon. They're getting excited. They're running around the ledge and they fall out. Something scares them. We know that their response is flight. So it's important to try and put in some safety measures. When you have an indoor cat, they say that it compromises welfare. They don't do as well as outdoor cats. Okay, there is an increased risk of obesity in indoor cats. There is some increased illnesses due to environmental limitations. They don't get to be as much of a cat as they can be outdoors. But outdoors is not all roses as well, because there's an increased risk of injury, there's infectious agents, there's poisoning, there's predators. It's important I've put a photograph here because specific, you can't put any collar on a cat, and you must not put a ribbon or tie a ribbon on a cat because it can snag somewhere, especially if the cat goes outdoors. So what you get is quick release collars. They're not very expensive and they're available quite easily now, even on Amazon, which if there's any tension, they pull apart and they open. So at least there is no harm that the cat will get strangled. So this is important. Nowadays, they say that the compromise between the indoor and the outdoor lifestyle is to actually train the cat either in a harness to go out for walks, much like dogs do, or to give them a space, an enclosed space, which is safe, where they can at least do some listening to birds, hunting, chasing, running, basking in the sun. This is important for them. So the last bit is about enrichment. We need to give a cat an opportunity to hide, to scratch, playing sessions 10 to 15 minutes a day. No playing with hands and feet, because if a cat learns to jump on the feet and pounce, they have a very strong prey drive and a hunting drive. We know that. They will try and jump on anything that moves. So if owners are not warned about this, then you have a cat who's biting owners, and this is very difficult to then deal with. Puzzles and feeders. So this is a little ball on the right, which throws out kibble. So you can increase their evening feeding time by giving them their kibble in a ball, and this takes them an hour to push around and eat. And stimulation is very, very important for cats. Moving on to multi-cat households. So we know time and again that cats are solitary, that group living is actually driven by resources. A cat, you will see cats eating together outside. This is because there's a human who feeds them and feeds them all together. If they have a choice, they would not come together and eat like this from the same bowl. They have a range of remote communication. They spend a lot of time communicating and trying to avoid each other and avoid uncomfortable situations and avoid close communication. So it's very against their basic nature to be living together or being introduced and being made to live together with cats that they haven't chosen. And this is what we do when we put them in multi-cat households. In the US, they say 40 to 70% of cat households are multi-cat. I think in India, my experience at least, it's a little bit less. But there are a lot of cats, a lot of households which are multi-cat, and there are a lot of behavioral and health problems that are associated with this. So they are associated with negative welfare outcomes.